Knock, knock, knock. How you doing today? My name is Dylan. I'm going to be your nurse. Can you tell me your name?
Michelle.
Your full name, please?
Michelle McKenzie.
All right, for sure, Michelle. Nice to meet you. Can you tell me your date of birth?
October 24th, 1971.
Perfect. How was the drive into here today?
Great.
Good, okay. Well, all these questions I've asked, it shows that she's oriented to person, place, and time. Her communication and speech is within normal limits, which is good. Okay. And also with that, I just kind of did your Glasgow Coma scale, which shows that you're responsive, your eyes are open, you're awake, you're alert, you're kind of in the room you're in right now, which is nice. Okay. So that's all out of the way. I'm going to get you to stare right at my nose. And I'm going to shine a light in your eye. I just want to keep looking at me, okay? Perfect. Awesome. If you want to stick your finger about 4 inches in front of your nose, and then just slowly stare at it while it goes and touches the tip of your nose. Perfect. All right, so what I got from that is your pupils are equal, they're reactive, they're round. They're reactive to light, they're round, and they accommodate, which is the nose touch test. Okay, next, I'm going to get you to stick your hands out kind of like this. I'm going to get you to push up. I'm going to get you to push down. And I'm going to get you to put your arms in this way. I'm going to get you to push towards me. I'm going to get you to pull back. Perfect. That shows your arms are good. They're not flaccid or spastic. I'm going to put my hand on the side of your head. Push. Beautiful. Same side. Beautiful. One more time in the front. Great. So your muscle, your tone is all good. You're ready to 5 for all of them. Next, I'm going to get you this little thing. It's kind of just a clip that goes on the tip of your finger. You might have seen it on TV. It is called a pulse oximeter. It's just going to tell us your blood oxygen level. Okay. And it's good. You're about a 98, 97. The normal range is 95 to 100%. So you're right on the spot there. I have a question for you. Do you have any cough? Have you had a cough this week, kind of recently?
No.
No cough, no sputum coming out, no like kind of phlegm?
No, it's all good.
Perfect. Okay, you're not getting sick. Your oxygen, your normal air with the room is not applicable. You don't have a cannula, you don't have any respirators. Okay. I've noticed just by observing you, your chest rising and falling, your respirate is normal, it's unlabored. It's at the normal range of like 16 to 22. So you're good there, you're just normal breathing. Do you have any issues breathing, any pain?
No.
No, good, perfect. So next, I'm just going to auscultate for your breath sounds. So I'm just going to listen to your chest. So what I want you to do is just get comfy. I'm going to put these in, and I'm going to listen. So every time I put this on your chest, you're just going to take one big breath for me, okay?
Mm-hmm.
Go in, nice, and out, in, and out, in, and for this one, I'm going to go on the side. Nope, perfect. So they're audible. I can hear your breath sounds. There is no crackles, wheezes, or rhonchi, or any friction rubs. Actually, before I continue, I'm going to do the back too, just in case I missed anything from the front that we couldn't hear. And the same thing as before. You're just going to take a few deep breaths. In, good. In, good. Good. And one more time. Perfect. All right, now you can get comfy. We're going to keep moving along here. Second one, I'm going to put your hands out, kind of just stretching your arms. So what I'm doing is I'm inspecting your arms for symmetry and color, any inflammation. I'm looking at the edema. If you have any in your arms, which you don't, you're perfect. You have the nice, warm, dry skin. You're looking pretty normal. Any pain there when I was touching you?
No.
No, good. Okay, so actually, if you want to stick your hand out again, sorry. Going to do your cap refill, which is just seeing how your blood's flowing back into your hand.
Sure.
And yours is good. It's supposed to be below 2 seconds. You're about 1.5 seconds, which is good. You're right on time. And for this next part, I'm going to get you to you can either lay across on the bed or you can sit here, whichever is more comfortable for you, because I'm going to be taking a look at your peripheral pulses, which is on your legs and arms.
Okay.
So whichever is more comfy for you. Perfect. Okay. So I'm going to start up here. And I'm going to get you to kind of turn your hand out. Perfect. So I'm going to look at your radial pulses on both sides. Good. It's there. It's normal. You hear the S1, S2 sound. If you heard an S3 sound, that's called galloping, and that's abnormal. Sorry, if you felt. Perfect. That's your radial pulse. I'm going to get you. Do you mind if I roll your pants up?
No, go ahead.
For sure. So now that I'm down here, I'm going to do the post-tib pulse and the dorsal pedalis pulse. Perfect. And we could also, sometimes you do the femoral pulse, which is around the groin area. We're not going to do that for this assessment. And while I'm also down here, I'm just going to kind of check your legs for any edema, any swelling. 2, 1. While I was down here, I'm also checking any edema. I mentioned that before. There is no swelling, there is no retention, but since I kind of missed it when I was down there, I'm thinking of it now. I'm gonna get you to lift your leg against my hand. Perfect. And I'm gonna lift your leg, I'm gonna get you to push it down. Same on this side. Push it down, and then lift it up. Good, kind of see that you have good motion in your legs. All right, so you can keep laying down or you can sit up, whatever you're more comfortable doing, because I have a few questions to ask you now.
Okay.
Have you peed yet today?
Yeah, I did this morning.
Yeah, you peed this morning. Was it clear? Was it kind of cloudy?
No, it was
Anything?
clear.
It was clear because of kind of a pale yellow color.
Yeah, they're pale yellow to clear.
Perfect. And any sediment, any kind of particles floating around?
No.
No, perfect. Okay, and when you peed today, or any time, did you notice any burning, any pain in your lower abdomen or your back?
No.
Nothing like that. Perfect. Okay, so, and when you do pee, do you find it's more of a trickle, kind of like you sometimes go to the bathroom when you might not necessarily need to pee? Like you kind of just trickle out a little bit?
No, no, it's a good flow.
It's pretty normal, okay. All right, last question for you then. Sorry. You're not incontinent. Incontinent means that you maybe pee involuntarily.
No.
Nothing like that. Even when you cough.
No, I'm good.
No, you're good. Perfect. Okay. So moving right along. If you want to, if you wouldn't mind sitting up for me.
Okay.
Sorry for making you do all the moving.
No.
I'm going to get you to look at me, open your eye, or open your mouth, sorry, and stick your tongue out and say, ah.
Ah.
Good. So what we're looking for there is your oral mucosa and your tongue to make sure there's no white patches, which would be a sign of infection. Okay. Continuing right along. So I'm just kind of, if you wouldn't mind, I'm going to make you move again. I'm going to get you to lay back down. I'm just kind of, I'm assessing your abdomen, looking for any distension, any abnormality. If there's one side that was a little more out than the other. No, you're looking good. Okay. And I'm going to ask you questions while you're down there. When was your last bowel movement?
This morning.
This morning. Okay, perfect. And how was it? Was it kind of, was it a little bit liquidy? Was it solid?
It was solid.
Normal kind of, like
Yeah.
your average everyday stool?
Yes.
Perfect. Okay. And with continence, which is would you ever have any time where you accidentally use the washroom without control?
No.
No? Okay. And nausea, Robin, I could tell that you seem pretty good, but do you have any nausea going on right now or any time recently?
No.
No, have you vomited in the last couple days?
No.
Perfect. And your nutritional intake, would you consider it's adequate, it's kind of normal? You try to eat relatively healthy
Yeah, I eat healthy most of the time.
most of the time? And
Yeah.
you get good fiber?
Yeah.
Perfect. It's always good. So next, if you're okay with me touching you, I'm going to go poke around your stomach a little bit.
Okay.
I'm going to be assessing, I'm going to be palpating very lightly, just for any distension, any lumps. And you tell me if you feel any pain while I'm doing this, okay?
Okay.
Okay, good.
It's all good.
We're all good. And I don't feel any lumps, any swelling. So that is exactly what we want to hear. Or see, sorry. So speaking of hearing, now I'm going to listen, if you don't mind.
Nope.
Perfect. So I'm listening for audible bowel sounds, which you should be able to hear, especially when was the last time you ate?
At breakfast.
Breakfast time. Okay, so you might not hear too much now. On an average person, you might hear the gurgles right after they eat breakfast or lunch, but you're all good. Everything sounds normal. Just what we want to hear. Okay, you can keep laying or you can sit up. I'm just going to test your skin for symmetry
Okay.
and color. So on both sides it is good. There is no pallor, there is no distension, everything looks pretty normal. Any redness, any inflammation you notice, any wounds recently?
Nope.
Oh, perfect. So I'm also going to test while I'm down here your skin turgor, which is nice. Good. It's nice and retractive. Okay. And your skin color is a nice white, kind of, it fits your ethnicity.
Mm-hmm.
Okay, continuing right along. You have no redness or inflammation, so we're going to assume there is no infection in your skin, and you have no noticeable or visual skin lesions on your arms or your legs, so that is all good. Okay, so now I heard you have some pain. Is that true?
Oh, yeah.
You're feeling a little bit of pain. Can you tell me a little bit where the pain is?
Just in the lower part of this leg.
Just in the lower part, so kind of past the knee to the ankle?
Yeah.
Okay, so when did that start?
Oh, probably about 2 days ago.
2 days ago. What were you doing when it happened?
I kind of went over on my ankle a bit.
Oh, okay. Were you just walking around? Were you skating? What were you doing?
I was putting wood in the garage.
Putting wood in the garage. Okay. So when it happened, was it kind of a sharp pain? Is it still a sharp pain? How does the pain kind of feel
It's just a throbbing.
It's like a throbbing, kind of an achy, like you might have just pulled a muscle or something.
Yeah.
Okay, you notice any redness or inflammation around the area where it hurts the most?
No, it's just all over.
All over, okay. And is there anything that makes it worse, like standing on it, walking, exercising?
Standing on it for long periods of time.
So do you have to do that often with your job, or?
Yes.
Yes, okay. And is there anything that makes it better, like probably like laying it up or putting it elevated?
Yeah.
Okay.
That makes it better once it's elevated a bit.
So you're telling me that when you elevate it, it feels better, when you walk on it, it feels worse, but it doesn't feel broken. Like you can still walk on it. and
Yeah.
stuff. Okay. So there's no inflammation that I noticed, and that you can be walking on it. So you seem all good. And we're gonna pause.
3, 2, 1.
All right, hey there, I'm sorry. We noticed that earlier we decided that you had a little bit of leg pain, and we noticed that your leg was actually sprained.
Oh.
So I noticed you had a cast on now for a couple of days. I was wondering if when you had the cast on, you noticed any hot spots, kind of any section of underneath the cast?
No, it's good.
No, it's all good? Okay, and it's all intact. You noticed that there wasn't any strips, any kind of cracks in it while you're using it?
No.
Perfect. And you can't move your leg at all in it?
Just,
So when you walk, you can still kind of move around?
yeah.
Perfect. And I'm going to inspect the area. I'm going to inspect your ankle area right below the cast, see if there's any edema, any swelling. To notice if the cast's too tight, maybe, or interrupting blood flow to the rest of the leg. If you wouldn't mind wiggling your toes for me. Perfect. Any pain there?
No.
No. Awesome. Okay. So there is no distension. There is no swelling on the ankle or the foot or below the knee or where the sprain is. And is there any pain after the cast has been put on? Any increasing pain?
No.
No. So they kind of find it's helping a little bit? Okay, perfect. Well, this is the best we're going to be able to do for you right now. You might have to come back in a few weeks when the cast gets taken off. For now, if you want to sit up, we're all done.
All right.
You did great. Thank you very much.
Thank you.
It was a lovely time meeting you, and have a great rest of the day.
Thanks.